some people want to say, you know, well, we didn't know all these things were happening, but I do think to your points, we've known about these crises for a long time. Maybe they haven't always been accepted within the general public, but these aren't necessarily new. They've just been exposed, as you said, Randy, as like fault lines. They've been exposed much more than they were before. And going back to that affordability, when you know, Adam and I, or some of the groups that we work with, talk to, whether it be municipal, provincial, or federal politicians, there always seems to be this sense, but we can't afford really to take care of climate. We can't really afford to deal with COVID. We can't take care of people forever. We just can't afford that. And I think probably both of you have different perspectives on the affordability side of it. So start with you, Randy. Is, you know, we can go with where that started from, but more importantly, is there any truth to it that we can't afford to take care of climate? We can't afford to tackle inequity or poverty or these COVID repercussions?
Well, I don't want to take up the entire hour. This is such a great question. You know, I guess a better question to me is, well, could we afford to ignore COVID? Could we afford to fight World War II? And that's the same question to me as, can we afford to address the climate crisis and the inequality crisis that's going on right now? It all depends on where you think the crisis is. And you'll act, if your furnace dies at -60, let's say, in Yellowknife, in the winter, you're not thinking, can I afford a furnace? You're thinking, I'm going to die within probably 3 or 4 hours if I don't get my act together really fast. And that's the way we have to deal with the crisis that we're facing. Now, having said that, the crisis is absolutely not on the financial side in Canada. And I'm going to give you a few reasons why that's the case. The first is, right now, interest rates are incredibly low. Government of Canada debt is, depending on how long you borrow it for, it could be 0.25%, it could be 1.25%, but it's basically the rate of interest that we're paying on our new debt, and the debt that we have generally is falling as well. We are paying interest rates that are less than the rate of inflation. So in other words, the people who are lending to us are actually paying us to borrow the money. So it's kind of ridiculous to say, wow, we better quit paying that. We better pay off that debt because we're going backwards. We're not going backwards, we're going forward. And you saw a very interesting example of that, where in spite of the fact that the government of Canada spent $225 billion, which is roughly 10% of the entire economy, just borrowed that money, and then lost $120 billion because of lack of tax revenues coming in. So you've got $1/3 of $1 trillion that we're further in debt now than we were 6 months ago. And yet interest payments on that debt are in real terms lower than they were 6 months ago, about $4 billion lower. So that gives you an idea of just how low the interest rates are. The other thing is the amount of debt that we've accumulated, really not that much compared to historical standards. Right now, it's probably going to end up this year that Canada's debt relative to the size of the economy, which we call the GDP, debt to GDP ratio, it's going to be about 50%. Well, back in the 90s, it was 66%, and interest rates were extremely high in the early 90s. After World War II, it was over 100%. But here's the funny thing about after World War II. The economy, which had been buoyed up by public spending on, you know, equipping an army with over 1 million people and sending people around the world and growing food for them, the economy that had been built on spending public dollars didn't collapse after World War II. In fact, it was the most successful era in the history of the Canadian economy, roughly from 1945 to 1975 or 1980. And the reason it didn't collapse was that we were investing in so many things. And I think I've got to stop talking now, but the climate emergency and the other emergencies are such an opportunity to invest and to put that Lego structure back into one that we like and one that suits our needs now. We can do it.
Mm-hmm.
We've done it before in worse conditions than this, and we can afford it.
Yeah, for sure. And Dr. Howard, I assume as someone who's taken the Hippocratic Oath, the idea of can we afford to take care of people? Can we afford to take care of our planet? Not saying that you're not an economist or that you don't know anything about economics, but I'm assuming your perspective on affordability and compassionate care would be would kind of be maybe from a different frame of reference than what Randy was talking about.
Yeah, I think what's really interesting, I do research as well as clinical work. And what you realize when you're doing research is that the most important thing is for you to define your outcome of interest really, really carefully. And so when we look at the fact that we've been using GDP as our default measure of interest for so long, and then compare that with where we want to go, you can see that it sort of doesn't really make sense. And I think that that's one of the reasons why we're so poor at costing in our externalities. So, can we afford, if you actually put a cost to, for instance, deaths associated with air pollution. So, in 2015, on the Lancet Countdown policy report that we did a couple of years ago, we calculated that there were over 1,000 transport-related deaths from air pollution in Canada in that year. And if you use a loss of economic benefit, the number that Health Canada comes up with, I think it was about $5 billion. But where is that in the Parliamentary Budget Officer's report, right? And, similarly, where is the negative externality associated with tailings ponds cleanup or orphan oil and gas wells? Where are we, when I've spent a lot of time on the Parliamentary Budget Officer's website lately, and I really liked, his estimates around guaranteed basic income. And, he did subtract out, some of the other programs that maybe they wouldn't need to have if we did have a guaranteed basic income. But there was absolutely nothing about, the MinCome experiment, which showed that there was an 8.5% decrease in hospitalizations, right? So if you're a policymaker and you don't have a degree in public health and you haven't recently, done a lit review on the MinCome experiment, how would you be expected to know that in some other pot that is maybe not the budgeting pot that you're directly responsible for, but, is broadly important to you, someone could, we could have an 8.5% decrease in hospitalizations, and think about the cost savings that would be. And so I think, the fact that we haven't defined an outcome, and I would propose, moving towards an outcome like what they have in New Zealand, a well-being based dashboard. So we know where we're going, what we value, we've defined it for ourselves, and then finding a better way, like whether it's hiring a bunch of health economists, sticking them in the Parliamentary Budget Officer's office and say, hey, do your best, please, to give us some estimates when you produce these reports so that we have a fuller sense of the impacts on, natural capital, social capital, human capital, as well as financial and built capital. I think that would give us a much better structure to use as we make these decisions going forwards, where we're, trying to figure out the costs now and make decisions that also have relevance to costs in the future.
Mm-hmm. Absolutely. Just before we get on to the next question, I just wanted to say hello to everybody on Twitter and Facebook and those that have joined us through Zoom. Feel free to add your questions into the chat. Adam, my colleague, has put some links in there as well, so you can find more about our speakers and more about the work that they do, as well as the Just Recovery Simcoe, who happens to be the host tonight. Yeah, and we'll be taking speakers' questions probably in about another 10-15 minutes. So it's really interesting that the perspective that you both shared about this idea of, it almost seems like we're stuck in a paradigm, whether that be using the GDP, whether that be kind of, as you were saying, Dr. Howard, about we're focused on an outcome, and are the measurements, the tools that we're using leading us to the outcome we want. My old boss, when I was in corporate, used to say, you only measure and spend money on the things you care about. So whatever your value statement is, if you're not measuring it and if you're not spending money on it, that's really not your values. So I think what I hear a lot from what you guys are saying is that really where we think we want to go, it's not it seems, and correct me if I'm wrong, it seems like the systems that we have in place, whether it be how we allocate funds, how we set up the policies, how we measure the effectiveness of those policies, seem to be leading us further into more inequity, deeper into the climate crisis. Am I on the right track here?